Hello, lovely family. Welcome back to my channel. It's me, Faye, your fellow yummy mom. It's been a minute. So, if you're just joining me, welcome, welcome, welcome. And if you've been here before, this is. So, I went through some videos released by social media influencer and his wife, MC Bakara and Lolo Bakara. And they were talking about their first child and only daughter, Eke Mama, with cerebral palsy. And honestly, I must say they are very brave, like very brave for what they have gone through and what they are still going through. I really must commend them. And sometimes saying people online and I know they try because a lot of people were just antagonizing them, saying, is it that you are not proud of your child, blah 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 blah. We are just stressing that family, are stressing that little one. So from what they talked about, he said, okay, this thing is they really actually spread a lot of awareness because from listening to them, I found out that a lot of things I do not know about that disease. Sorry. And I was like, okay, let me make a research of this disease and let's talk about it. So yeah, cerebral palsy, CP for short, it's a permanent brain damage that actually restricts movement and muscle coordination that is found in infants and little children. And sometimes it happens before birth, during birth, or even after birth. That's after the child has grown up a bit, it can happen. So there are a lot of things that causes cerebral palsy. Genetic issues, if there's a genetic disorder, there might be a possibility of child having it. If the mom has an infection that is left untreated, whether it's a viral or bacterial infection, it can bring about this. If there's a stroke, whether the baby experienced stroke or seizure or the mom experienced that, it can cause it. If the baby was born prematurely, there's a high chance that the baby might have cerebral palsy. If the baby did not receive enough oxygen to the brain, that's as it's in the case of this couple I just mentioned now. Yes, so it can cause that. Jaundice can cause it. And even if baby has grown up a bit and baby experienced head trauma, can cause cerebral palsy. So looking at the whole thing is just so painful because as a mom, I can't even think about it. Like, you've gone through the whole steps, you went for a anomaly scan, you checked, the baby is okay, and only for this to just happen. Like, after everything has been done, you just look and like, on the day of delivery. So what happened was that she had a prolonged labor. Yeah, and she had the baby had loss of oxygen to the brain. The baby was stuck. So we don't actually know what made the baby stuck. It can be the shoulders might have been stuck. It might be the prolonged labor. So things that can cause shortage of oxygen, preeclampsia, if the mom has that. So shortage of oxygen in birth is called birth asphyxia. So things that can cause it umbilical cord issues when the cord is around baby's body, any part of the body, throat or whatever, right? Placenta has a problem. If there's a prolonged or difficult labor, you see that prolonged or difficult labor, someone is laboring for 1, 2, 3, 4 days. Yeah, the baby is tired, the mom is tired, everyone is tired, and this can cause lack of oxygen. Most time, if you ask me, if a labor prolongs up to 24 hours, please just go through a cesarean section. Just do a CS. Save the baby's some strength and save yourself strength. Yeah. There are many people I know, they did labor. They labored for 3 days, 5 days, and still at the end of it all, still cesarean section. You might be like, it's a Nigerian thing. It's not a Nigerian thing, no. The lady I know about 3 days was in US. The other day they know about 5 days. It was in UK. So I don't know. So they just allow you to just label. And once you see that the label is going beyond 24 hours, just carry yourself. Sign it. I beg. Cut me open and remove this baby. Let us all rest, because the baby is struggling to come out. You are struggling to push the baby out, and something is holding the baby back. You are not feeling dilated or something. Yeah. So the best thing for everybody, cut the mom open and bring out this baby. Cesarean section is just the perfect solution. So yeah, back to lack of oxygen. What are the causes? Umbilical cord issues, like I said, placenta problem, prolonged or difficult labor. Yes, you're laboring for a long time. It can cause lack of oxygen to the brain for the baby. Complications during delivery. There was one show I watched. I don't even know which of the shows I watched. One of these medical shows I watched some time back. I don't know if this can be a real life event, right? So the woman was rushed into the hospital. She was full time, right? She was rushed to the hospital not because she was in labor, but because she was having epilepsy. So she had this epileptic seizure and all of that. So they injected her. I think, I can't remember, but they injected, I think, in her neck or so. So after injecting her and all of that, she got to herself. Shortly after, she entered full labor. All right, now labor was progressing as it should. So when it was time for her to push, the seizure started again. So this mom was in seizure. They're trying to bring out the baby. They're trying to save the mom. They keep injecting her. She was not responding to the injections. She was still seizing. Her teeth were clenching and all of that. And it was just a pathetic sight. So that's complications during delivery. Yeah, so at the end of everything, the mom died. The baby survived. They had to cut her open, bring out the baby, but they could not save her. Yeah, so complications during delivery can cause lack of oxygen to the brain for the child, preeclampsia. That if mom has preeclampsia, it can cause it. And like I said before, it shows that it's been stuck. You're trying to bring out babies, well, even this baby is a human being. You're trying to bring him or her out, and the show that is stuck in the birth canal can cause lack of oxygen. Lack of oxygen can also be HIE, and what it can do is that over time it causes disabilities in children, brain damage, and sometimes can even cause death. So how long can a child stay without oxygen? If a child stays 10 minutes with no oxygen, there is a high percentage that there will be brain damage. If a child stays 25 minutes without oxygen, high percentage that is death. So Lolo and Bakara was talking about, her and her husband, they were talking about their baby. When the baby came out, the baby was already in distress, right? Because of all the complications during birth. So the baby came out and they were like, okay, this baby needs to have oxygen right now. Nigeria happened to them, which is so painful. And I told them, there's nothing they can do. There's no oxygen in this place. In the whole general hospital, because when I'm about to give it, people say general hospital, they have a lot of specialists, have a lot of this. It's the best place to go. If you go to private hospital, you don't know what you may encounter. And these people went to general hospital and there was nothing. There was no oxygen. And that's so shameful. In a whole general hospital, no oxygen. Okay, then I had to rush. The husband and the mother-in-law had to rush the newborn to the teaching hospital. I don't know how close it was to the general hospital. When they went there, you know how most government hospitals are. Fill form, fill this. The other one was like, take care of this baby. This baby needs oxygen right now, right? Be giving this baby oxygen, we can be filling the form. They say, no, you fill form, you do this one, you do that one. By the time they finished all those things, I say, hey, the oxygen is not even here. You will have to go to the ICU unit, go and pick up the oxygen and come in a different building. The nonchalance is just so annoying. So by the time they came, baby had been a long time without oxygen. Definitely, your guess is as good as mine. Definitely brain damage. A baby that was normal and okay, because at the time they scanned this baby before birth, this baby now had cerebral palsy. So it's such an unfortunate case, and I just want us to, I think Lola and her husband are actually sharing that to create awareness of things that can happen when you're giving birth, things you don't understand that can happen. Things might happen that might go beyond your plan. So try to get a good hospital. Yeah, I will never say they don't get a good hospital because general hospitals are good hospitals. So what even happened? It's just Nigeria just happened to them. It's just so painful. Because okay, talking about general hospital, I just remember the case now. Like somebody was telling me about one of her friends that is a sickle cell person, and she was telling them that my first child, when I gave birth to my first child, I had to take blood transfusion and all. So now I'm pregnant for the second. I'll have to use blood transfusion. Although it was not the same hospital she gave birth that she went to for the second child. The doctor was saying, "Are you going to teach me my job? Are you going to teach me my job?" Do you know that this woman gave birth? There was complications after delivery. They needed blood transfusion. These people did not have any of those things. They did not have blood. They did not have blood. My God. And this woman told them, they didn't have blood. This poor woman died. This happened this year. This poor woman died. So, I will not, would you not say, it's not a good hospital. They went to a good hospital. I just feel that, I don't know. Just, from the time you find yourself pregnant, just be praying. Like, God, I beg, oh, God, I beg, God, I beg. Because all these people that Nigeria happened to, none of them would have wanted any of these kind of things to happen to them, you understand? But life happened, Nigeria happened to them, and that's it. So I really feel for Lolo and her husband with Eke Mama, what the baby's going through. She has episodes in which that some of them are very painful and all. I can't even imagine what that baby is going through. I can't imagine what that baby is going through. My prayers are with you guys. I just pray that the Lord help you all. So like I'm saying, like I said before, if you're giving birth, you know, now normally you have to pray, and then make sure it's a very good hospital, because everything needed for any complication after birth should be available. Oxygen, if you need to go for CS, if you need to do blood transfusion, all those things should be available. It's crazy. You think, yeah, we don't have. It's crazy. So yeah, be very careful. You're having a prolonged labor. I'm begging you. I can kneel down and beg you. I'm begging you. Please, go for CS. The labor is becoming prolonged, it's becoming difficult. Must give birth by like a Hebrew woman. You're a Hebrew woman, please go for CS. Please don't kill yourself. Do CS and get yourself and your baby alive. Please. It's not until the baby have pooped in your stomach and baby is already pale as anything. You don't know where that cord is around the baby's neck. You don't even know. Please go for CS if you're having a prolonged labor, okay? All right, that's all. Just ranting today. Like, I just ranted today. Love you. Bye.